Hi again. All right, we're now moving on to Chapter 19, Sections 3 and 4. I'm going to combine the both. So we already talked about the first section, second section. Now we're moving on to childbirth. So the birthing process. You're going to be reading page 498 and 499. There's 3 diagrams there regarding the stages of birth. You have labor, delivery of the baby, and delivery of the afterbirth. The afterbirth is also known as the placenta. That's an organ that's alive when the woman's pregnant, but once the baby's delivered, that placenta is no longer needed. So it's an afterbirth. It will come out, and you do not want that in there because once it's served its purpose, because it's a dead organ, and then toxemia will occur. So you are going to be reading about the process of labor, and again, labor affects everyone differently. So some women have no problem with labor. Some women take it all natural with no medication, vaginal birth. Some women have C-sections. Some women are in labor hours and hours on end, almost up to 24 to 36 hours. Personally, I did not know I was in labor in my first pregnancy. I was 9 days late, and I couldn't feel anything. I was like, didn't really know that, I was in major pain, because being an athlete all my life, I have a high pain tolerance, but I just felt uncomfortable. Like, I don't know, like I wanted to eat, but I didn't feel like eating, and I didn't think I should eat, but I wanted to eat, and then I didn't have any pains. But then realized that I was in labor. So delivery of the baby goes to the birth canal if it's a vaginal birth, and then of course the delivery of the afterbirth, that's regarding the placenta. All right, so then you have postpartum period. So postpartum, or you may hear postpartum depression. Not every woman who has a baby goes through postpartum, or maybe they do, but they're called also the baby blues. Maybe they do that, but it's not for a long period of time. But research shows that postpartum after childbirth affects a lot of women. They get really depressed. Sometimes they need medication to help get through the depression. That doesn't mean that they don't love their baby or they don't want to take care of their baby, but it affects every woman differently. The mother goes through a lot of hormones during the pregnancy, and a lot of changes to her body, and not just physical, but psychological changes as well. So any woman who is going through postpartum, it's legit. It's not fake, okay? So you also will have you could have some complications during pregnancy. I'm not saying that every person who has a child has complications. There's some definitions here about stillbirth, cesarean section, and premature birth. So stillbirth, that's basically when the baby dies in the mother's womb. For whatever complications, sometimes they don't know, sometimes they do. So back in the day, way before I was even born, in the mid-60s, my mom had a stillborn baby. And again, mind you, this is prior to ultrasounds, they hardly ever did C-sections back in the 60s and 70s. And my mom carried my sister for 9 months and did not know when the baby passed away. So, but nowadays, with the ultrasounds and, amniocentesis and all the technology, not that it doesn't ever happen, but a lot of doctors, if you get medical care throughout your pregnancy, they'll be able to determine, if they need to take the baby early or not. All right, so C-sections. Well, I've had C-sections for all 3 of my kids. So basically it's, they're tearing your lower abdominal area. So like underneath your belly button. And if you're a hunter, and you guys cut the deer open, it's almost like that, but not transverse. You're going side up from left to right. So a C-section, of course, is usually done only when there's medical issues. They're not going to just do it just to do it. But some doctors, once you have a C-section, they rather have C-sections for the mom for the rest of her children, unless, the mother gives a vaginal birth, and that's okay. They're not against that if it comes naturally, but there's always that chance that the mother can tear the lining between her vagina and her anus or her rectum area. So that's why some doctors prefer just all C-sections. I had a C-section for my first child because, again, remember I told you I didn't know I was in labor. I was 9 days late, and we went in and we found out that the amniotic fluid was low and possibly gone. My daughter's umbilical cord was wrapped around her neck, and that was getting her into oxygen deprivation. So that's where I had my C-section because of her. My second daughter, mentioned it earlier before, I was preeclampsia, on the onset of preeclampsia. I had toxemia. I was on the borderline of gestation diabetes. So because I had a C-section with my first daughter and the doctors weren't happy with all the test results and my blood pressure being too high, that my second daughter came 6 weeks early. So therefore she was premature. And then my third child, my son, he was not premature. He was a C-section, and everything was good with him, but we had complications with him afterwards. So I mentioned in previous lessons that he has a condition, and that's with him for the rest of his life. So that was pretty scary. I mean, I had him full term, had a C-section, and then there were complications during delivery, and to this day he still has to see some specialists, but that's what happens sometimes. So you have premature birth, C-section, and unfortunately a stillbirth, and you have your natural birth. Some women who go natural birth or vaginal birth, they may take may get a shot called a epidural. So it's a really long needle that goes in the back of the mother's spine. So if you kind of feel the back of your spine, and they have this long needle, and they tell you, Mrs. Hawkins, don't move, because they're putting this needle in your back to numb your waist down, and if you move, you could get paralyzed. So that's called when you're getting the shot, it's called an epidural. Now, sometimes some women can't have an epidural because there's no time. The baby just comes right away. Some women don't want to take any medication, and that's their choice. So you can have natural birth with no drugs. You can have natural birth, vaginal birth, I'm talking about, with medication, or women have C-sections. And of course, you're going to need C-sections. When you have C-section, you're going to need medication for that. Also, some doctors will possibly use forceps, like they're these huge, big, like salad forks that would bring the baby's head out if the baby gets stuck. Or they would use like these little suction cups to this kind of like a little mini vacuum, but it's not a vacuum, to bring the baby out of the birth canal, which is the vagina. And sometimes, if the baby's head's too big and the shoulders are too wide, the mother has to get a episiotomy, which they tear the little bit of skin between the vagina and the anus to open up the birth canal. So a lot of stuff happening when a woman gets pregnant and has a baby. All right, so moving on to page 502. This is talking about low birth weight. So sometimes a contributor to low birth weight would be nutrition and smoking. So you want to make sure that your baby is weighed properly throughout your pregnancy, and the mother's weight is proper, and you're not risking your child. Multiple births. So we have here regarding twins, identical twins, fraternal twins, triplets, or more. Excuse me. So on page 502, this is talking about 502 and 503, talking about multiple births. Now, just to let you know, it's very common for women to have twins naturally, and maybe 3, but our body is not developed to make a litter of babies like how dogs and cats are. All right. Some people who cannot have children will get what is it I'm thinking of? They will get fertility drugs to help them have children, and they may have multiple births, more than like 2 or 3 kids, maybe like 3 or 4 or 5. So, but be in mind, that's not biologically normal for us women. We can have twins, we can have 3, but having 3 naturally is very uncommon as well. So the definitions to those are on page 502. And then 503, you're seeing some diagrams of the difference between identical twins and fraternal twins. You'll see that basically, in a nutshell, that identical twins share the same egg. They're fertilized by 1 sperm, and there's 1 egg. Fraternal twins, there's 2 different sperm and 2 different eggs. So here's the house, right? Okay. And then the cells break up, and then for 1 egg and 1 sperm for identical twins. And then when you have fraternal twins, you'll have 2. Okay. So you have 2 eggs and 2 sperm, but you come from the same parents. Okay. So it's pretty amazing how our body works on that sense. All right, moving on to section 4, childhood. So if you remember back when we were talking about Erikson's child developmental stages, right, from newborn to adulthood, from teenage to adulthood to elderly. All right, so here we're talking about childhood. And it's going to break it down to birth to 18 months, like what occurs to the child mentally, physically, and emotionally, 18 months to 3 years old, then 3 to 6, and 6 to 12 years. So that's pretty much like childhood. So you look at your you're looking at newborn to toddler stage, to preschool, to early elementary, to late elementary, to basically middle school. All right, so therefore you want to make sure that you understand what's happening during all these stages. Some basic ones for birth to 18 months old: baby cries, eats, sleeps, goes to the bathroom. He or she learns how to sit and crawl, stand, walk during that time frame. All right. They're very vocal. They'll laugh, they'll scream, they'll cry. They don't really know how to communicate very well yet. So some researchers think that, and I agree, that teaching baby sign language when they're little helps them communicate. So like, this is eat, this is water. So just little things like that helps communication. 18 months to 3 years. So this is when the baby is able to play along with others. They're definitely building their personality. They're learning words. They're able to communicate a little better than before. They're showing some independence. They're able to run around the house and get into things mischievously. You may even also hear like your terrible twos, their behaviors, their tantrums, their happiness, their sadness. And be in mind, though, they're still not able to fully explain what they're feeling. Ages 3 to 6, this is when they're able to play with others. They're being creative. They have lots of energy. This is your early elementary school age, so they're learning, their language. Multiple languages is the time when people say that I've read that the best time to teach a child different languages is before they're like 3 to 6. So that'd be cool. I wish I was able to speak more than one language. So then you're moving on to 6 to 12-year-olds. So this is a time frame when they're somewhat self-sufficient. They're able to pick their own clothes, brush their teeth, maybe have some small chores. They're able to work things with themselves. They're less centered in the sense of who they are. They have a lot of interests, a lot of friends, a lot of hobbies. They're trying their independence per se on that. And then when you're moving on to page 508, this is the middle to late childhood. So this is when you are late elementary to middle school. All right. And some of you were just there last year because some of you are freshmen right now. And this is when you are growing physically, mentally, and your friends, your social status or your social life is important to you. So you are going through the onset of puberty during this time. And you want to be independent. You're able to feed for yourself, like in the sense of maybe make macs and cheese, clean your room. Your peers are very, very important at this time. And you are influenced easily at this time, pro or negative, by your peers. All right, so this is the last portion of chapter 19. By this time, you should be able to have all the vocab, and you'll be able to submit that into your due date. And if you have any questions, you just email me. Take care.